Hi guys, my name is Pia Pawani and today I'm in Aster Al Rafa Hospital, Gubra branch for a consultation with Dr. Manar, who is an aesthetic gynecologist. So come with me, let's go ask her some questions. So Dr. Manar, aesthetic gynecologist, so let's go have a chit chat with her. Hello doctor.
Hello.
Good afternoon.
Good afternoon.
My name is Pia Pawani and I have an appointment with you. I think we're going to have a nice consultation. And I have a list of questions that I want to ask you. But before that, I want to know a little bit about you. How long have you been here? And what is it that you exactly do with Rafa? So just give me a brief about yourself.
I'm Dr. Manar Jabbar, a specialist in obstetrics and gynecology, and I have master degree in aesthetic gynecology. Today, inshallah, we're going to talk more about aesthetic gynecology and what we mean by this new subspecialty.
So tell us a little bit about aesthetic gynecology.
Actual aesthetic gynecology, it's a subspecialty or branch related to gynecological department. The main idea of aesthetic gynecology that we are giving our client procedures, daily case procedures, or even surgical or non-surgical, that we are making some like cosmetic procedures for intimate area.
Oh, wow. Oh, okay. So why do you think it's so important nowadays?
Actually, aesthetic gynecology is a specialty. We are not talking just about cosmetic procedures, but also we are treating at the same time health concerning problems, like for example vaginal dilatation, urinary problems, etc. So by these procedures that we are doing, we can solve the cosmetic part and the health part also.
Oh, I so agree. Yes, absolutely. Yeah.
Actually, this subspecialty started a few years back. We are regarding as like a little bit a new specialty related to gynecology, but the main point that with time, especially recent days now, there is more beauty self-conscious, and maybe many of patients, they are suffering from some problems with even their health problems, I mean, that we can solve it by simple ways.
So doctor, when you say this, is it mainly for beauty purpose or it's also to do with health? You know, is it to do with...
Thank you so much for this nice question. Actually, aesthetic gynecology, not just for aesthetic or cosmetic purposes. Also, we can solve or treat many health issues at the same time. Like, for example, patients complaining from urinary incontinence or uncontrolling their urination in a proper way, or maybe vaginal dryness, especially in old age group, postmenopausal vaginal dryness, or vaginal itching. So we have certain diseases that can be treated by same products or by laser or alternative ways.
Doctor, so what are the procedures that you specifically do, you know, in Aster, and what are the products that you use? If you could just tell me a little bit about that.
Yes, actually in Rafa we are offering non-surgical procedures for aesthetic gynecology and laser also. I will start first of all by the most popular and requiring procedure, depending on our clients that they are asking for, the filler, vaginal filler. The purpose of this filler is a special type related to the intimate area, that giving volume and shape for intimate area, especially after vaginal deliveries and aging, losing too much weight, or these things. So by time the patient, she will start noticing that the volume lost and the shape not properly or asymmetrical shape. So by this filler, we are trying to give the finalizing shape that fold and the skin texture, baby skin, and moisturized and healthy. The other products, I'll speak about them briefly because we have many products. Also, we have the anti-aging vials that we're injecting in a special way for the intimate area with a special machine that very fast and fine needle, not causing pain to the patient. So this anti-aging, it will give the texture for like young, yeah, and fresh, hydrated, pinkish to white in color. Also, the most asking the glutathione, and the glutathione, as you know, and many patients sure they know about the glutathione, about hyaluronic acid. This Profilo, very famous injection containing hyaluronic acid. So it will give little volume and will hydrate the skin. It will be pinkish to white in color, more hydrated, smooth, glowing skin, and we will fill the small defects that are present in the intimate area. Also, we have other products like vitamin C whitening because it's very required and it's going like nothing. We are like composed of cocktail containing many substances: glutathione, hyaluronic acid, vitamin C, vitamin A. At one injection, we can give to the patient, and she will notice the result from the immediately after finishing of first session. طبعا sure there are patients maybe they will need like more than one session. Depends on the degree of like darkness, severity, and if she has any other factors that causing this darkness. And here we have products like vitamin C, hyaluronic acid alone, if patient asking just for hyaluronic acid. And also we have chemical peeling. We have two types of chemical peelings, as you know, with time and age and the area, the intimate area, no fresh air, no sunlight. So by time and maybe fungal infection, bacterial infection, it will cause like layer of dead cells that will cover. So by chemical peelings, we will remove all the layer of dead cells, and we will give chance for the new skin and the new cells to form to be up. So sure, sessions different from one patient to another, depends on degree of darkness, and we have also another peeling that's just one session, one time, and it will solve the problem of darkness immediately.
So, doctor, last question, yeah. What do you think we should all be prepared for before we, choose a particular procedure, or would you prefer that you check and then you suggest, what I should go for?
So any patient want to come, I have to prepare her before procedures, like 3-4 days before a procedure. I have to give her certain medicines or certain instructions that she can do it, and later we can start with the procedures without any problem.
Oh, doctor, thank you so much. Thanks for patiently answering all my questions. And I am very excited to have our first physical consultation, and also excited to see the new me and feel the new me. So thank you so much. Looking forward to it.
Thank you. So we welcome all our patients in Aster Hospital, Al Ghubra. We are offering very good service for mothers and babies, and also aesthetic gynecology.
Great.
In case of any questions or explanations, queries, I can offer for our patients and for you, sure, to come anytime. I'm available every day in Aster Al Hospital, Al Ghubra, to explain more about any health issues related to obstetrics, to gynecology and aesthetic gynecology.
Great, thanks.